So hey guys, I'm Dr. Jackie and welcome to my YouTube channel. Today I am going to, stop. Make sure you hit like and subscribe before I go any further. But today I got some good information for you. I am going to talk about a very common STI that is often left out of the list. Today we're talking about Trichomonas. Trichomonas is, like I said, a very common STI that is caused by a parasite called Trichomonas vaginalis. And Trichomonas vaginalis is found in both men and women. Believe it or not, 70% of people are asymptomatic, meaning only 30% of women typically complain of any symptoms. What are some symptoms, if you even get symptoms, of Trichomonas? Like I said, 70% of people are asymptomatic. But if you are in the 30%, for women, which I only see, typically will complain of itching and burning and a greenish yellow discharge. And oftentimes it will have a bit of an odor. Men will typically complain of the same thing, but I'm gonna be honest, ladies, men are rarely symptomatic. So one of the reasons that women get infected is men are mostly asymptomatic. What are some of the complications of Trichomonas? I'm going to repeat it again. 70% of people are asymptomatic, but if there is a complication, believe it or not, it causes an inflammatory process in the vagina, which makes it easier to get things like HIV and hepatitis. Pregnancy. Women who are infected with Trichomonas have the risk of preterm rupture of membranes and preterm labor. So there are some complications. With one of the biggest complications is it's transmitted sexually. So you really want to make sure when you're seeing your doctor, if you have any symptoms or suspect that there are any symptoms, you get tested. How is Trichomonas diagnosed? For most, it is an incidental finding on a woman's pap smear, or she goes in with a complaint and we see it on what's called a wet prep. In most cases, we take a sample of the vaginal discharge, mix it with saline, and you look underneath the microscope. And ladies, it's this little bug that is swimming everywhere, and it's got this little tail that's whipping. Can't explain why it's itching and burning. There's also a really expensive test that they can send off, which costs a couple of $100s, but the easiest way is to look underneath the microscope slide. So the treatment for Trichomonas, unfortunately, is really one or two drugs. And we've all heard of Flagyl or metronidazole. In most, if not all instances, we try to give you metronidazole or Flagyl by mouth so that it gets in your system. Believe it or not, 4 tablets, 1 dose, boom, it's done. But don't forget, you gotta treat your partner. So make sure that your partner is aware. Now I'm gonna tell you a little secret. Most men will come back and say, my doctor said I didn't have it, because they're not going to the source, which means they would have to go into the penis to actually get specimen. They use a urine specimen and you don't see it. So whether he has it or not from his doctor, he needs to be treated. And you guys need to treat at the same darn time. Take your medicine when he takes his and vice versa, because if you take yours, he didn't take his, and you have sex, you're reinfected. So make sure you're being treated at the same time. How can you prevent Trichomonas? Okay guys, listen. You either are going to abstain, no sex, or you're gonna use a condom. You gotta cover it up. So anywhere you're having sex, orally, anally, or vaginally, needs to be protected. The only 2 ways to not get it is condom or no sex. So now this is another definition of a quickie. You know what I mean. A quick tidbit on Trichomonas, a commonly found STI that's rarely talked about. Now make sure you hit like and subscribe so you can get some more quickies.